give you some perspective, there's been well over 45 individuals that have been actively involved in making this lab a reality in 12 days. And this, by the way, has received certification and approval from CMS, CLIA, and CDC. So we really are ready now as an institution to take the fight to the virus in conjunction with our clinical partner, Ochsner, and really begin to move the needle in taking care of individuals here in Louisiana.
When it was started, the Emerging Viral Threat Lab was set up as a diagnostic lab for detection of the coronavirus in the community. That lab really morphed into a larger entity, which is now the Center of Emerging Viral Threats. It's really the Center of Excellence awarded by the LSU system, and that includes not just the lab, but also viral diagnostics, which is in the lab, sequencing for variants, elements of outreach for education, wastewater surveillance, the vaccine distribution. So it's really, as a center, it has multiple facets that are essential to public health for our community, region, and the state.
The EVT strike team took COVID-19 testing into the community. Nursing homes, churches, schools, and sporting venues all became testing sites with samples brought back to the EVT lab for processing. Over the last year, the lab created over 300,000 test kits and processed samples from 58 of 64 parishes across Louisiana. Researchers at LSU Health Shreveport were also leading the way on treatment, working on multiple clinical trials and participating in the Pfizer vaccine trial, the only one in north central Louisiana. As vaccines began to be approved, the now Center for Excellence of Emerging Viral Threats, or CEVT, expanded into vaccine distribution. LSU Health Shreveport was an early adopter of large drive-through vaccination sites like the one at the Louisiana State Fairgrounds and smaller pop-up locations across North Louisiana. LSU HS even partnered with local hospitals to make a large number of doses more accessible to the community. As LSU Health Shreveport leads the fight against COVID-19, the cities of Shreveport and Bossier City have honored the efforts with awards from the Bossier Chamber of Commerce and the declaration of LSU Health Shreveport Day by the city of Shreveport.
I, Adrian Dwayne Perkins, Mayor of Shreveport, do hereby proclaim Friday, December 18th, 2020 as LSU Health Shreveport Day.
As the pandemic draws on, the CEVT continues to test and vaccinate while moving into a third stage. Genetic sequencing of COVID-19 in cooperation with national and international efforts to better understand the virus, enable epidemiology work, and inform future vaccine efforts.
In essence, we were generating lots of diagnostic results, and as you're generating those results, we had all these RNA samples that had to be purified from patient samples to make a diagnosis. And they were just sitting in our freezers. And so I just said, hey, let's sequence these. And luckily the answer was yes, get it done.
LSU Health Shreveport is the only academic center in Louisiana with this capacity.
You know, we have been leaders, absolute leaders in sequencing Louisiana viruses. I think we did over 95% of all the sequence data from the month of December 2020. Overall, we've done about just under 65% of the total sequence data on the coronavirus from Louisiana.
The sequencing has led to the discovery of new variants that are now circulating around the world.
The issue is if you don't sequence, you don't know about these changes in the spike protein that may be making the virus a little more infectious for people and maybe of greater concern to the general public, may make vaccines a little bit less effective.
As the COVID-19 pandemic began in March of 2020, LSU Health Shreveport quickly turned the idea of helping to fight COVID-19 into real-world action, the creation of the Emerging Viral Threats Lab. And now, 1 year later, the Center of Excellence for Emerging Viral Threats is leading the way in the fight against COVID-19 and stands ready to face the next challenge.
It's really been fascinating to watch this develop. It's been fascinating to work with all these wonderful people to get to the point where I think we are better off as a university, and I'm hoping that what we have built and where we are going will make this, our medical school, make our city, our region, and our state a better place going forward.